parents are enrolling their kids, some as young as 3 years of age, in these so-called Iron Kids events. And considering the obesity epidemic in this country, it can be a way to get your kids interested in a healthy lifestyle, but obviously raises the question, how young is too young for a vigorous competition? So on that note, we're going to make rounds. Joining me now, Robert Jones. He's the race director for the Silicon Valley Kids Triathlon, and Allison Van Diglen. She's a parent of 2 kids who have participated in these triathlons. And with me in the studio, Dr. Kevin Plancher of the Plancher Orthopedics and Sports Medicine Center. He's also an orthopedic surgeon, also teaches at Albert Einstein College of Medicine, and welcome to all of you. And Robert, I'm going to start with you. Was the genesis the obesity epidemic, or was this an extension of parents wanting to have their kids involved in what they were already doing?
I assume the question is, why are we doing this? We actually, this is the 10th year. 2009 was the 10th year of the Silicon Valley Kids Triathlon. So we started this event because we wanted to celebrate the acceptance of triathlon as an Olympic sport in the year 2000. But, you know, we really are aware of the, I hate to use the word fattening of the American youth, but I guess you can't hide that. So we did this in order to give kids an appreciation of the outdoors, of physical activity, get them away from their Game Boys and cell phones and all of that. So we've gotten great reception from parents because they seem to agree with us.
And Allison, as a parent of 2 kids who have participated, are we talking about age-specific adventure, or we're not talking about the adult typical triathlon?
Absolutely. Well, I was initially quite concerned about how long the distances would be, and I thought it might be, you know, these mini Olympians. But when I found out that the running distance is only 1 mile and the cycling is only 6 miles, that really reassured me. So it's really, you're talking definitely about age-appropriate distances. So,
Dr. Plancher, I mean, we all know that sometimes things are too young, that the joints and tendons and ligaments can only take so much. But on the other hand, we are seeing kids fatter than ever before.
It's true. It's exciting that kids can go out and have a lifestyle of running, biking, and swimming. But we still have to be cautious because these are children. This is not an adult. There are growth plates, and we don't know the long-term effects of some of this under the age of 7.
So as someone who sees sports injuries, is 7 a cutoff, as you would say, as a doctor? Because I know, some events are even inviting, 18-month-olds and 2- and 3-year-olds.
Right. And since, it's a great question, Nancy, but since we don't know results for less than 7 years of age, we're just being careful that it shouldn't be as competitive as a adult triathlete.
So you could be 6, just make it fun.
Make it fun, so they're really getting out there and enjoying themselves, so that we watch that we don't have injuries, we don't know these long-term effects.
Robert, what about the parents, and we all know they exist, who decide that this kid is going to be the next uber-duper athlete? How do you rein back those tightly wound parents who frankly are pushing kids too young, too fast?
Do you guys hear them?
Yeah. Robert?
Yes, I'm sorry. We got slightly disconnected.
It's all right. Now that we're reconnected, I ask you, how do you, and because we've all seen them, throttle back those parents who are just a little too tightly wound, and they're frankly pushing their kids a little too young, a little too fast?
Well, actually, in my experience of 8 years being race director of this event, I haven't really found that to be the case. We don't have.
Well, I don't want to make fun of where you live, but having lived in California, I know the Silicon Valley pretty well. I would think, in fact, you do have parents who push their kids a little bit.
Well, there are, we've all heard about the soccer, with all due respect, the soccer moms and the Little League dads. But our event, and it's one of the biggest, if not the biggest in the country, has a very good family atmosphere. We find that there's far more supportiveness between moms and dads and their children, and the aunts and uncles and smaller and older brothers and sisters. I mean, it isn't a high pressure environment, and in fact, we don't promote that. Our whole philosophy.
And Dr. Plancher, I'm going to let you jump in here. Is that the whole key? Not having it too competitive, not having it overwhelming.
I think, Dr. Nancy, if it's not competitive, they're having fun, they're out doing the sport, there's nothing better. Our First Lady and the President has said we need personal fitness.
Yeah.
This is the beginning of it, but we have to be cautious because every parent believes their son or daughter is going to be the next athlete of the century. And we have to remember, we don't want everyone having an artificial knee at age 45. We just don't know.
Bingo. All things in moderation. Robert Jones, Allison Van Diggelen, thanks for sticking with us through some audio problems from San Jose. And Dr. Kevin Plancher, a pleasure. Thank you.
Thank you very much.